Hey everyone, have you ever thought about attending a psychedelic retreat, say for example, in a country like Jamaica? First thing that comes to mind is what can you anticipate? And more importantly, is the product that I'm taking safe? You may be surprised at some of the information that we just found out. We break it all down in our latest podcast. Hey everyone, welcome to the Dales Report, and happy to be joined here this afternoon. Back to the podcast, Tim Moore. He's the CEO of HAVN Life Sciences, which trades on the CSE under the ticker symbol HAVN. Check out that shirt. You look good. You're getting lots of sun. It's a good time of the year. Everybody seems to be getting happier. How are you?
I'm doing great, Shad. How are you doing?
Great, as usual. How's things been? I know it's been a little bit challenging, to say the least, when we look at a macro level for the overall market right now. But for the most part, I know that behind the scenes, still, like a lot of companies I speak to within this space, you'd never guess the times that we're currently going through right now, but because it just seems like the ball just keeps getting pushed forward for a lot of companies behind the scenes. Agreements, supply agreements, distribution partnerships, mergers and acquisitions continue to happen. Are you finding the same thing with what you're experiencing?
Yeah, Shad, there's a lot going on. A lot of companies are very active. I mean, I know we are, but I'm in contact with people at other companies. I follow the news feed from a bunch of different companies. There's a lot going on. I mean, there's advancements on the research side. There's M&A activity. There's patents getting filed. There's, new products being launched. It's still crazy busy.
Yeah. Interesting announcement that was made late last month with Numinous and Novamind, if you saw that. But I wanted to have you guys on. I want to begin with great news that was just announced. You announced a partnership with psilocybin advocate group TheraPsil, which is big news, government program. It will support healthcare professionals in requesting psilocybin from your company, HAVN Life, and other licensed dealers enrolled in TheraPsil's Project Solace through the SAP, otherwise known as the Special Access Program. So define to me what this opportunity presents for you as a company, because this kind of invites you to a very who's who, I should say, within the industry.
Yeah, Shad, it is a big announcement. It's important for us because the Special Access Program is going to provide patients with access to otherwise unavailable therapies. And part of that is you need to have physicians and clinicians that are trained. And TheraPsil offers a comprehensive training program for those people so that they can properly administer psychedelic-assisted therapy. Then you need to have treatments that are approved. So for us specifically, it's getting the HAVN naturally derived psilocybin approved by Health Canada to be a candidate drug for the Special Access Program, so that those trained physicians and clinicians can actually prescribe it. So it's a big step forward for us to be able to participate in this government program.
So just to recap for my viewers, under the SAP, prescribing healthcare professionals can request psilocybin manufactured by Health Canada, as you said, for approved licensed dealers for seriously ill patients requiring emergency access to this medicine. So we can assume that as the program expands, along with the science, you can expect this to become more extensive in the future. So one, how does that happen? And two, why is it important for people to understand the growth trajectory of this partnership?
Well, so currently access to psychedelic-assisted therapy in Canada is only available through being granted a Section 56 exemption, which currently is being limited to end-of-life patients under extreme circumstances. That opportunity isn't very large because Health Canada has only issued like 53 of those exemptions. So
is that all?
Yeah, it's really small numbers. The Special Access Program allows any physician to petition Health Canada for permission to treat a patient who's shown a lack of response to other treatments. So, treatment-resistant depression, PTSD, a number of indications that patients have not responded and that they're in severe need, particularly if a patient is having suicidal thoughts.
Yeah.
It allows the patient to have their doctor petition for use. So we're going to see significantly more numbers there. If you look back almost a decade now to cannabis, we saw a parallel program where patients were having their doctors advocate and they were getting permission to have medical marijuana. And so, what the government has to do and what they're doing under this program is making sure that there's a safe and reliable supply of products, that there is a regulated protocol for administering it. So TheraPsil is
What's that like? Like, what are the initial requirements when meeting with government officials like that to, I guess, have you entertained in some of these conversations, and most importantly, to confirm that you're providing a trusted product?
Yeah, so Health Canada just in the past week issued guidelines around what's going to be required. And importantly, they included both naturally derived psilocybin as well as synthetic psilocybin as drugs that they will consider for the special access program. So that's a big breakthrough. And then they've laid out all of the steps for approval. It's pretty comprehensive. It's really around good practices, around GMP practices. In our case, we cultivate our mushrooms under Good Agriculture and Collection Process program, which GACP. We then transfer it to a GMP, or Good Manufacturing Processes facility, and then we export it from Jamaica as GMP product. So under that, we are confident that we'll satisfy the requirements of Health Canada to qualify.
So the psilocybin that's provided will be exported from your cultivation facility into Jamaica. Am I understand that correctly?
Yeah. So currently we're cultivating in Jamaica, where the product is treated as a functional food, much like coffee has caffeine in it. Arguably, caffeine's a drug, but it's a food. And in Jamaica, psilocybin mushrooms are a functional food. We operate under the Ministry of Agriculture. We're working in cooperation with the government. They're eager to build a psychedelic industry there. We've already successfully exported from Jamaica into Canada and the U.S. to validate our supply chain. And so as we get approved under this special access program and physicians are prescribing it, we'll be able to export into Canada to satisfy that.
That's great. What's the big takeaway, you think, for your shareholders that you want to communicate? Because a partnership with an official government program speaks volumes. So what is it you want to communicate to your investors? Because this is a big announcement.
Well, we are going to be one of a very small group of companies that have approval. It's not going to be a long list. There's a significant barrier to entry here to assemble the intellectual capital and the processes in order to qualify. So they will be approving other molecules, presumably MDMA and others, but we'll be on a very short list of psilocybin suppliers for the special access program. That's exciting. It translates to revenue for us, and it translates to growth.
As this program, as I said, becomes more extensive and matures, do we have an idea as to how it will progress over the next year to 2 years?
We really don't. I mean, it depends on how quickly Health Canada wants to move forward in identifying specific groups and then approving those various groups. And I've said this before, Chad, I think that veterans and first responders as a cohort are likely to get approved as a group.
Yes.
I think they're going to be near the front of the list. Obviously, Health Canada has already shown that end-of-life patients are on that list. And I think that we're going to just see the numbers grow pretty significantly. Once we get enough doctors and clinicians trained to support it, then the growth will be pretty fast.
One thing I found over the weekend I was unaware of, too, is that there are a lot of military veterans that get attention towards suicide, and rightfully so. But I didn't realize that the highest suicide rate now is amongst athletes in North America. And you wonder as to how, I don't know if there's been enough. Yes, there has been some conversation towards it, but you wonder how that expands and starts to mature towards the overall industry as well. But did you understand that, or did you know that stat?
I'm not surprised by the statistic, because if you think of elite athletes and the investment that they've put in preparing themselves for it, and then they have maybe they have a disappointment, whether they don't make a professional league or they don't make the Olympic cutoff or whatever it is. Those disappointments can be pretty devastating. And I guess the other challenge for elite athletes is their careers are fairly limited.
Yeah,
they come to their career, and what do they do next?
Yeah,
if they haven't prepared for it, that could be a pretty bleak view looking forward as well, right?
We learn lots within this industry, that's for sure. Well, you continue to make moves in these market conditions, which I applaud your efforts. This is now your fourth distribution partnership expansion deal within the last 2 months. Earlier this month, you also announced a supply agreement with what was called Atman Retreats, which is a retreat center located in Jamaica, helping people to explore psychedelic therapy. So in this agreement, you will supply naturally derived psilocybin for use for all of the programs. So do we have an idea as to what the market size potential is for something like this? Like, how much of an interest level is it right now amongst these retreats, and more specifically Atman Retreats in Jamaica?
Yeah, so there's a number of retreats that have opened up in Jamaica, again, because it's a place where they can do that legally and with the support of the government. And we're in discussions with some other retreats as well. Atman happens to be a Canadian-based company that operates the retreats.
Oh, okay.
And so, we had an established relationship with a member of their executive team. We worked through him. And, it's exciting for us because, Atman's the first one. It will open the door for us to be with additional retreat centers. And there's huge interest. I mean, they're able to charge $2,000, $5,000 for a 3-day retreat.
Wow. And how many people are they having on, let's say, the retreats during that time frame?
They have a couple of dozens people on each of the 3-day retreats. So,
okay.
If you go through it, they can have hundreds of people per year. I don't know in specific numbers, but their capacity is obviously hundreds of people per year. So when you go across all of the retreats in Jamaica, you're talking thousands of people that are going to these retreats. And it's not just Jamaica. There's also retreats in Antigua, Costa Rica.
Yeah, of course. Are you looking to expand not only retreats within Jamaica, but across the Caribbean?
Yeah, we are. We're in discussions with a few operators, and as soon as they make their decision, we'll be able to make our announcements.
So when we look at regulated GMP product that's being available, what is like, there's got to be some interest level amongst these retreats right now. Of course there is. But what are they doing right now, and what do they need to improve on or change, which segues obviously you into the equation?
Yeah, so the state of the art right now is you have 3 to 3.5 grams of mushrooms in a cup. You add some warm water, and you drink basically a broth, and that's it. Or you eat the mushrooms, you just consume them, as a
right.
mushroom. The challenge is that because they're not cultivated and don't under appropriate conditions and don't have a certificate of analysis, you don't know exactly what kind of a dose the person is getting. We're going to be able to provide them with a certificate of analysis that they can provide very specific dosing for these people. If you're spending $2,000 to $5,000, you kind of want to know what dose you're getting.
100%.
Right. So we're replacing what the most pejorative way to say is the street mushrooms. We're replacing them with GMP,
right,
naturally derived product. And specifically, we're going to be delivering them with dried, ground, homogeneous mushrooms that have a known quantity of active ingredient and have been tested for contaminants. And so that's an upgrade in quality and safety for Atman and for the other people that we're in discussions with. And it's an upgrade for the people that are attending.
That's probably 75% of it. If I'm going to try it and open to the idea, just for myself personally, would I be nervous? Yeah, sure, because I'd want to know exactly what the dose that I'm getting, right?
Yeah, and if people are curious, what are these retreats like? On Netflix, there's a show called Goop Labs by Gwyneth Paltrow. Season 1, episode 1, she takes her team to a retreat in Jamaica for a psychedelic experience. So in 40 minutes, you can learn everything that you need to know about what's a psychedelic experience in Jamaica look like. And I encourage people to watch that. It's a pretty good exposure to what that's really like. And it is very intense, and it does reinforce why you need to have a trained guide with you, a trip sitter with you for these episodes. Or in a clinical setting, you need a clinician sitting with you that's trained in assisting people in it, because it's not.
How does that work, Tim? How does that work, Tim? Because there's going to be situations where people, let's say, are taking a naturally derived product, and even if it's like managed as far as the amount of dosage, and somebody goes down whatever a road where they start to not feel comfortable, or let's say have a bad trip, do we have an understanding yet as to how these doctors bring them back and calm them down?
It really, it's a matter of talking them through what is the trauma that they're dealing with, because that's what happens on these psychedelic experiences is you confront the trauma that is the root cause of your depression, your anxiety, your PTSD, and it can become emotionally overwhelming. So you need someone there to comfort you, to coach you, basically provide psychotherapy for you,
right,
with this experience. And I would encourage anyone that's contemplating self-medicating to make sure they have somebody with them that can assist them. This isn't something you should do on your own.
So these retreats, it looks like you will then replace otherwise known as like the street drugs, so to speak. And now it's obviously a lot more regulated. Do you hear from people that want to attend these retreats that that's important to them?
What's important is they want naturally derived. They want to be as close to the plant as possible. So for us to provide them with dried ground homogeneous mushrooms of a known quality and known active level is an upgrade from just having a handful of mushrooms and not knowing exactly what you're getting.
Yeah. So we bring all these distributions and supply agreements together. What's the growth trajectory plan over the next 6 to 12 months? It's not easy times right now in this space. The biotech field has been destroyed. I have spoken to a few people, though, that do believe that we have hit bottom. We could see a downward turn of another 5%. But people with money are smart. They're now getting involved because they see this as a great opportunity to see growth opportunities, such in industries like yourself. So what would you say if you're like sitting in front of a group of investors right now? Is your growth trajectory plan over the next 6 months in association with all these announcements?
Well, we're one of a few psychedelic companies that will be in revenue in 2022. It sets us apart because we've based ourselves on a supply chain to deliver products to other companies that are using it, whether it's the retreats, psychedelic-assisted therapy, or new drug development. We have the ability to be in revenue this year. So it's an infinite increase from last year's revenue on psychedelics, and so it's terrific. And at the same time, we're seeing growth on our nutritional supplement business. It's continuing to grow. We're getting increased traction with retailers, with e-commerce. We just shipped our first container of product to Australia for a white label project there with our partner, World Pharmaceuticals, that we distributing it. So we got lots of growth coming in 2022.
That's great. Last thing I wanted to touch on, you attended what was called Planet Microcap, which is a conference for microcap companies that took place earlier this month, I should say, in Las Vegas. The conference was agnostic to any industry with, as mentioned, a focus on the microcap industry. So I have to ask, what was the overall general interest and consensus when it came to psychedelics while you were there?
Well, first of all, the show was exceptionally well run and well attended. Robert Kraft and his team from SNN Network did a great job of putting it together. The socializing events, the presentations, the one-on-ones were all very well organized. And there were over 500 people in attendance, so there was a good deal of interest. Companies as well as individual high net worth investors, family offices, bankers. There's a good mix of people in attendance.
What were some of the industries that were there?
There were plant-based food. There were mining companies. There was one really cool company. They have an electric outboard motor, like the Tesla for outboard motorboats, which looked really neat. So it was a pretty broad range of companies, yeah.
So high net worth investors that were there, did you have a chance to meet with some of these people, and like what was the feedback on what they thought about the overall psychedelic industry, and most importantly, your story?
Yeah, so the structure of the event, the first day was company presentations. The second day was a full day of one-on-ones. And I ended up having 11 one-on-ones meetings.
Oh, wow, okay.
It's enough, frankly. It's a long day. And I met with a couple of investors that were pretty interested in our business. And I would say that the general feedback was based on what we've been accomplishing and the press releases that we've been putting out. Nobody could really understand where stock price is, where it's at. We've been caught in the slipstream of the entire sector coming down. But there was significant interest, particularly in our traumatic brain injury product that we've just launched. There was a lot of interest in that, as well as the work that we've been doing on psychedelics and the supply agreements that we have announced and the initiatives we got there.
You always got to love that share price question, right?
Yeah. Well, every CEO would say that their share price is too low. It's encouraging to me when I hear investors say that it's too low. So.
Yeah. Well, so overall, it was a good experience, and you found that you made some good networks with some key people that liked your story.
That's exactly right. Yeah, I think it was terrific, and we're after 2 years of not very many live events. It was really great to attend an event that had that many people and was that well run. Isn't
it nice just to get out and see people again? This world's getting back to normal. And you talk about being in Vegas. They had 100,000 people down on that strip for the NFL draft. I was like, wow. Like, if I thought it was a bold statement. That's like life. Let's get it back to normal. But I think people have definitely moved on, and it's great to see it. I know it's just great, as you said, to see people face to face and get back to somewhat of some normality. And hopefully we can turn this corner and get this market back rebounding again, because the industry, as I said, and a lot of industries that we do cover, they're at 52-week lows, but the amount of framework that's being done behind the scenes, there's big growth opportunities for when this does turn, and bluer skies are on the horizon. Don't you agree?
I agree, and I'm really hoping that we see a change in the tide here very soon. It's challenging. Not only do we have, coming out of a pandemic, but we've got some geopolitical forces out there that are fairly significant.
Yeah, I know.
We got to see something's got to change, and it's got to change soon. I think there's probably still a bit of downside ahead of us, but there can't be that much. There's not much room to go.
Yeah. Well, we're not in a recession, and I said this yesterday. Sometimes we don't know until we're actually in it, but we have not had 2 consecutive quarters of negative growth. We're not there yet, but I do think that there's going to be a lot of movement as we head into the fall, coming into midterms, and I think that's going to generate some spike and get things turned around. But regardless, keep up the great work. I applaud, obviously, your efforts as to what you're doing behind the scenes, and let's keep in touch.
All right. Thanks, Chad. Good talking to you again. See you soon.
You as well. Thanks, Tim. Hey, everyone. Thanks for watching. We appreciate you giving this video a thumbs up. We also value your feedback, so leave a comment below. And if you like what we do, then share this video on your socials. And don't forget to subscribe to our YouTube channel and tap on that bell to receive notifications for all future videos that we post. Thanks for watching.